All right. Good morning, good afternoon, or good evening, depending on when you're going to see this webinar or podcast. Hello, everybody. This is Daniele Lattanzi. I'm your host, uh, co-owner and CEO of Eula Nutritional System, and also co-founder and CEO of Holistic Health Solutions. So today we have a great webinar with my friend Kaju Patel, owner of Spass Nutrition. Hello.
Hi.
Okay, so today we're going to touch upon a subject that is very much a problem on how to fill your practice and way on how to book your calendar and that's why we choose the title From Empty Chairs to Booked Solid 30-minute service that bring patient back every week. Yes, hello, Kaju, how are you?
Great. I'm doing excellent. Thank you so much for inviting me to this podcast. I appreciate it.
Yes, that's awesome. It's great to have you here. Actually, it's also the first time we do it live with two people right in the same room. So that's,
It's a webinar too.
yes,
Yes.
absolutely. So, Kaju, before we start, tell me a little bit about it. Okay, so what was going on in your practice before you were using this wellness device to with your inflow of public, how you were booking your calendar, and what was going on in your practice?
So we are a nutrition response testing practice, and we're actually a pretty busy practice in the sense that we see high volume of patients and we have great retention in the office. So when we've added these foot baths into our schedule and as an option for other patients, it's more for us to get and reach out into the community. So what we were doing was we have an empty space in the back room. We use that space for our workshops. We use that space for cooking classes, things like that.
Right.
But the space is not being used for anything else. So if you technically look at the schedule of the calendar, that spot, that area is empty.
Right.
We use that for other things. And so what we decided to do is why not maximize that space and fill our calendar more by adding in foot baths. We started with one, we have two.
Nice.
Two of the ionic detox foot baths. And with us having these in the office, it's helping us transition through our schedules better and keeping us full and busier in a good way.
Right.
Yes.
That's awesome.
Yes.
Cool. Now, how long you been using this wellness device? A few years now, right?
Yes. So at this point, we have been, no, more than a few years. We purchased our first one about 3.5 years ago.
Okay.
And then we ended up purchasing a second one about a year and a half ago.
Got it.
Yes.
Okay. So how, like, I mean, I guess that you answered the question, but how the idea came about, like, oh, wow, that could be a good way to get extra people.
So with nutrition response testing and with patients already understanding what we do in the office with helping patients, the second thought that came to our minds after we surveyed our area, we learned that in order for us to feel like we're more of a wellness place or wellness center, we needed to be able to offer some other options for them to make them come in and feel like there's more that they can do with us than just the nutrition response testing, even with us being as busy. Second is we support with detoxing, we support with relaxation. We're trying to support a lot of the women in our area and men.
Sure.
Of just having time to take care of themselves, self-care. So we thought, why not the ionic detox foot bath? And the way we came up with that is we had a family experience at a different office that offered it.
Oh,
And the family loved it. My children loved it. My husband loved it. We looked forward to doing a detox foot bath again if we happen to go back to that office.
wow.
And our practitioner there, our friend actually goes, I was like, this stuff is fun. It's amazing. It feels like it's just keeping us not just feeling better, but just like happier to be there, more relaxed. I feel like we were getting a little bit more out of our program,
Yeah.
which we're already getting so much.
Right.
And so we were actually asking, when can we get access to these foot baths ourselves? And just around that same time, you and I started offering them. And with that offering, we're like, this is great. Let me start with one. Let me practice using this, see how it goes in our office. And it was a hit.
Yeah.
Yes, it was a hit.
That's awesome. That's awesome. So using this one as a, like in your opinion and also expertise, or with your experience that you had, like how easy has been to introduce this service as an entry point to make your practice to be known in the community? Because I mean, obviously there is a different way how you can make your practice known, and I know you're very active on social media and doing education lectures and etc. But how do you see how easy is to use this as an entrance point for somebody else to want to get themselves known in the community?
I'm glad you mentioned that because I love nutrition response testing. It's what works. I'm the clinician, I'm the practitioner. It's the most important thing to me. But at some point where I live, where we are in the Middle Georgia area, wellness, organic food, nutrition, these are all misunderstood. People
Yeah.
do not know what any of this means. And so we were thinking, well, how do we reach out to the community and get the community to know we exist, we're here, don't be intimidated by what we do. Yes, we're different. We do things differently. We use muscle testing technique. However, just because it's not typical or looks normal to you, it is something that a lot of people have access to.
Sure.
So the foot bath has helped us with our open houses, especially as busy as we get in our open houses. I'm the only clinician in the office. I have a lot of free screenings to be doing.
Yeah.
So the foot baths and some of the other technologies that we use
Sure.
are used during during our open houses, or access to getting the medical doctors
Mhm.
to maybe send us some of their patients. So we've had a hard time with the medical community in Middle Georgia, but at the same time, we have a few medical professionals. They themselves have come in to use the foot bath.
Ah.
Yes, and with the way we work in our office, with our doors being open, people can see what nutrition response testing is, what it looks like. It makes them more comfortable. Next thing you know, they become our patients, and it's also a way to get their foot in the door. Because we're not saying, hey, the foot bath heals everything,
Of course.
but it is something we use in conjunction to fulfill our mission.
Totally. Absolutely.
Yes.
Absolutely. And glad that you mentioned about the open house. If you just to expand the concept, like what else do you do in an open house? What other things you offer or you do?
So we do our lectures,
Okay.
our mini workshops is what we call them.
Yep.
And I have those scheduled out every 30 minutes, and
Nice.
I keep it to 5 to 7 minutes.
Nice.
Then we also offer, obviously, we offer little treats and foods and snacks, things like
course.
that. Maybe a goodie bag or swag bag of some sort, but we have the heart sound recorder. And
Okay.
so we do free heart sound recorder screenings, just initial simple screenings so they can see the current condition of their heart.
Nice.
We offer the foot baths. We have 2 set up. Obviously, we can't get as many people to do it, but you can imagine the rush of the people coming in. And while they're there, now they're doing everything else, right? Waiting
Right.
for them to do their foot baths. We have the PEMF mat,
Yep.
and we have a couple of those. So we get those put on into the room. People are doing those sessions. And the nutrition response testing screenings, because that's ultimately where we want them to come.
Right.
And we have everything else in there. So
Totally. So obviously you do all those services so they can all merge into that.
Yes, because they all complement each other.
That's right.
Yes.
Totally.
And sometimes what a patient wants to come in to use something, and it's not always, a new person, not a patient, but someone who isn't an established patient, wants to come in just to use the foot bath. And you're like, that's interesting. They just want to come here only for the foot bath. And no, that's it. That's all they want to come in. And then they start asking more and more questions. We have a reading material set up to the side, so they are learning more about what else we do in the office. Our testimonials are there. They're sitting there for 30 minutes. They're relaxed.
Yeah.
Sometimes they go to sleep, but sometimes they have the reading material there. Gets them intrigued.
Nice, nice. And then talking more about the detox process, and obviously without going too much into the clinical, but more from also for other people to understand, like, do you offer some supplement from standard process or stuff like that as a sort of follow up to replenish from the detox?
So several times a year, we have set times where we are encouraging patients to do cleanses and detoxes. When we do that, and that this is based on your own area. For our area, I know which months work the best for us. Believe it or not, summer's a good one too, where we're at. But during this time, when we are offering these 21-day purification programs that are for us modified, different detox programs that Standard Process and MediHerb use, and other companies as well in the office, we can sometimes use the detox foot bath in conjunction to their detox programs to help them with just seeing if we can expedite any of this toxin removal that we can, but at the same time replenish their bodies and get them to maybe expedite their healing.
Right.
We are in an area where there's a lot of military. There is a lot of patients that fly frequently. It's an industrial area, it's a farming area, it's a military area. And the way our land is, it is dipped. And so toxins stay. And so for us, it's not always as easy to keep a patient well and detoxed well, or getting through detox well. So anything else we can do to help assist that, we do. And it is interesting to see the patients that fly frequently for work, especially with the military, or if they're working as civilians, to see what their detox foot baths look like before they go to travel and what it looks like when they're back from travel.
Wow.
Just because of the exposure they get.
Yeah, I imagine that it's a lot.
But we do it in conjunction with the nutrition response testing, so we can see what's going on with their foot bath, and then we can use that information and data to make sure we got them on the
right program.
Correct protocol. Yes.
Yeah,
it's
totally.
amazing. They work well together.
Absolutely. Now, going more into the usage of these tools to fill your schedule, right? Like you talk about that the session, I believe you were talking to me about the 30-minute session, right?
Yes.
So and how often these people, they schedule more than one session after they come for one time. So how's that process goes?
So typically in our office, we encourage them to get 5 visits at a time for the foot bath sessions. We've noticed clinically in our office, if they can do 5, maybe one time a week, depending on how their detox foot bath goes, one time a week or once every 2 weeks, they respond to it well. And this is how we like to do it and go ahead and get them scheduled.
Right. So you sell it as a package of 5.
Yes, they can come in for one and see, if this is the correct experience for them. We have a good protocol we put together for them before they do it. We want to make sure they're hydrated. In our office, we use it as an opportunity to have our patients relax as well. So our area is very cozy. It's got good music. The lighting is nice and calm. There's a few plants. It's very clean. The room is lavender
Right.
colored,
Yeah.
and they have cushions and pillows and everything they need. So patients are willing to usually just come back in a
Right.
week or two because they got the relaxation component into.
Yeah. So it's almost like become like a spa experience.
It does. It does. We try to make it as spa feeling as it possibly can.
Yeah.
Hmm.
Nice, nice. That's great. So now talking to all, I mean, obviously there is all kinds of people going to watch this podcast, but for practitioners that or practitioners that already have a practice, or somebody that maybe want to become a practitioners, like what could be like an advice on how easy is to get this wellness device into their practice? How to start with it? What somebody should do or consider?
Okay, that's a great question because that part is a little tricky. It seems like, oh, it's easy, it's easy. There's a bit of a learning curve, but it's totally something that you can do.
Right.
First, if you yourself have never experienced a detox foot bath, an ionic detox foot bath, you need to do it first yourself.
Right.
See how you feel, see how long it takes, use it. Then once you get your personal experience, you also get the experience of knowing how long it takes to put it together, how to use it, how to clean it, and how to have it set up for the next patient or client, depending on what you're doing.
Right.
So there's a bit of a learning curve there and practice. That's all it is. But if you, your team, depending on who you're with, practices it for about a week or two max, it's very easy to use at that point. For us, it was starting to get so popular and so busy. Spouses wanted to do it together. Moms wanted to bring their children in. It was getting to that point. When that happens, that's how we knew we needed a second one.
Right.
Okay. And when we're booking our clients, we like to make sure that there's enough of a gap between them so that somebody on the team can go in and be efficient, clean it up, sanitize, and have it ready to go for the next one.
Right.
Yes.
That's great. That's great. So, great. So that's kind of, those are the basic steps, right?
Yes, that is.
Awesome. Now let's talk about the impact on the patients, right? So, you have been doing it for several years now. Like, is there some, I mean, I'm sure you have a lot of success story, but is there some of them that maybe it kind of remain fresher or more make an impact on you of success with that?
Well, the first week that we implemented into the office, there was this patient who had been dealing with this awful sciatic pain
Okay.
that she had been complaining about. She's had it for several years, somewhat of a newer patient for us. She did the foot bath, and that pain that she's just dealt with and accepted was gone.
Wow.
And we didn't understand. We weren't sure. I'm going to be honest with you. We're like, really? That's wonderful.
Well,
that was really extreme for us. We're like,
yeah.
wow, foot bath, but it was true. I mean, she was going around telling everybody, like, this pain is gone, this pain is gone. And then the following week, we had something similar happen again, where another patient was like, that back pain that I always deal with right here? I don't feel that anymore. I think it's a foot bath I did. We're like, really? Which we were like, and then for me as the practitioner and clinician, I'm like, yeah, whatever. It was probably the supplements I gave. I don't know. I don't know if it was the supplements, the combination, who knows? But whatever, it's their reality. If that went away, and I kept asking about it each time after that, and it didn't come back. So I'm like, whatever it is, it came out. But my personal experience is I was having in the pandemic, just when we're touching so many patients, I was having very intense muscle locking or cramps in my legs, especially when I would walk uphill.
Mm.
I mean, I would struggle. You would. I don't know why. I've never had that issue. They would get so tight and it would hurt so badly.
Wow.
And I started doing the foot baths myself once a week, then once every 2 weeks. And within the first week of me doing it, that went away.
Wow.
And I was able to start exercising again. So Am I saying it's a miracle thing? No, but when we're on a program, we're trying to eat better,
Of course.
we're taking our supplements, and we add in some of this technology. That might be the one thing that we need to add in to help expedite the healing.
Right.
I mean,
Yeah,
for
plus
me, it was liberating. I
totally.
work out again. It was important. I'm
Yeah.
glad I was able to move again.
Right. Plus also each person being a detox, it may hit in a different way.
Yes. Well,
So-
hydration is key.
Yes.
You must stay very hydrated. We have strict instructions on our patients that before you come in for this, I need you to stay very hydrated for minimum 24 hours.
Mhm.
Please don't overdo caffeine coffee. If you have alcohol, things like that, please don't come in and do this. I mean, we're a little strict. And we have very high quality water we give them when they're there.
Yeah,
Yeah, we spend the money on the better water,
totally.
and we want them to be hydrated and happy.
Yes,
Yeah.
totally. Hydration is definitely key. So along the same lines is success with on the program and helping clients, like what is a tip that you can give to other practitioners in terms of that already have, a product like you that are doing well? What is it they can do to boost even to the next level, or at least like add an extra quality using this wellness device?
If you are continuing to grow your practice, and if you can use this as a way to just get people access to your office, maybe people that were not going to come in with just your basic marketing, gives you an opportunity to do more, maybe mini open houses, not such big ones,
Yeah,
and have enough time for them, maybe 2 or 3 people to do a foot bath session. You can also use it as, social media games or different marketing techniques you have where people would have to put their name in for a drawing, and they can win sessions to something like the foot bath because it's neutral.
yeah,
Yeah. There's also opportunities for you to use this to just get more awareness of what you do.
right,
Okay. There's a visual component to it. You
totally.
see the before and after of a foot bath. And with this day and age and people needing such instant something,
Instant gratification.
instant gratification, this is definitely a way for them to see a before and after.
Yeah,
Just like we use our HRVs and all the other things that we do in the office to get them to have that interest to work on their health even more. Mhm.
totally. And talking about this, actually, I see here we got some question.
Great questions.
Great. Let's see here. All right. So there is a question from Cameron. Say, at what phase of NRT do you offer or recommend the food bath technology, or how you screen patient for the whatever or not they will benefit from the food bath in the first place?
This is a great question. Of course, Cameron asks me the toughest ones. I love you for that. No, this is great. I definitely do want to make sure that the patient that I am recommending this to is a patient who is going to be open enough to do it. It is important that we're on the same page, we're in agreement. Second is a patient who is definitely fine-tuned. I don't like to just throw it in with newer patients. I mean,
Right.
for me, it's very important that they are understanding how nutrition response testing works, that I want to make sure they're taking supplements, they're doing everything else they need to be doing. And when we get that fine tuning phase done, that's when I think, okay, this is a good time now to add in something else, like a foot bath to help them detox, especially if they're complaining about weight loss or something that, okay, I can do this as a supportive way of them still doing the program correctly, but something to help them with that they can see as well visually, just extra expediting is what I call it. And then when I screen my patients, now I'm not the expert in the foot bath, but I know for a fact we want to make sure that they're able to physically do the detox foot bath, which
Right.
comes with directions. If a patient's had surgeries and has metal and things like that in them, no,
Right.
definitely not. but a patient who is well enough is the patients you want to do
Right.
the foot bath with.
Totally.
And kids do well with it. Cameron, kids love it. They will sit there, they will read a book, they will do whatever, but they will do it.
Right.
Mhm.
Right. Now, I notice on talking about kids and doing the detox with this foot bath, I notice on the instructions or seen that well, several success story from the company that producing this, that there is people that are maybe special need kids that
Mhm.
is very good. I don't know if you had any experience with that or not. I don't know if you would like to spend a couple of words on those or not.
I do. I actually do use it with patients of ours with autism and ADHD, things like that. They do well, especially when I've working on this patient and I'm like, oh goodness, such a high toxic overload on this child.
Wow.
Our patients have great moms. Their moms are making sure they're eating as well as they can, etc. But sometimes with behaviors and habits that these kids can have, if they start to have really itchy skin or rashes or something, that can be really hard as a
Yes.
family to get that under control. We know as practitioners, this is not an overnight fix. Oh no, they've developed a rash. It's not just going to go away before they reach for medications or something else. This is a great way for us to say, hey, let's see if we can dump some of this toxic load. That's what I call it. Let's dump some of this out and
Let's see.
let's work on the supplement part and the nutrition part and see if that gives the child relief. And many times children do well. My own children have had hives. One time my child developed hives from some pesticide exposure that he had in our area because he was playing baseball.
Oh wow.
And he asked mom, can I do the foot baths? They help. They help, mom. They really do help. He wasn't able to explain why it helps. He's 13, but he just knew, mom, I'm feeling better each time I'm doing them. Can I go? Can you take me back to the office tomorrow? Can I do it again?
Wow.
Yes.
That's a great.
Yes. So I've seen this. I think sometimes back to Cameron's question is how do you know they're going to benefit in the first place? You don't always know, but this is your opportunity to say, hey, I'm going to let you have one session on the house or give it one try, see how you feel, see what you think. And 90% of the time they're ready to do more.
That's awesome.
Yes.
Great. Well, thank you, and thank you to Cameron for the questions. Let's see if there is any other question. Seems that we are good. So, well, Kajol, thank you so much for being here. Thank you for your time. Thank you for people, and obviously, I think for any of you that would like to have more information about our wellness device, the Eon Foot Bath, I think it is a link that you will find here, and we'd be happy to answer any question you may have, give you directions and all the information that you may need. We are here for that. And again, thank you, Casual. Like it's always a pleasure to have you. And I look forward to all of you. See you next time to our next live podcast. Thank you very much.
Thank you, everyone.
Okay, bye bye.